My name is Tyler McCall with the Center for Presidential History, and I'm here today with Dr. Maria K. John of University of Massachusetts, Boston. Dr. John, thank you so much for being here with us today.
Thank you so much for having me, Tyler. It's a pleasure.
What is the most important message you want people to take away from your research?
So what I'm really trying to look at in my book project is the ways in which urban indigenous communities in the course of the 20th and now the 21st century have really pursued their claims to sovereignty through forms of healthcare and health activism. And what I think this allows us to see is the ways in which the struggle for Indigenous sovereignty has really shifted in very interesting ways over the course of the 20th and 21st centuries towards struggles that are not only bound up with really important claims to land and territory as well, but through pressing for other rights. And one of the ways in which my work really seeks to sort of bring the significance of healthcare and health activism to the forefront is in thinking about the ways in which these sorts of struggles have been continuous with a lot of the stories that are much more familiar to those of us that perhaps know something about Indigenous politics in the 20th century, right? A lot of the time, the attention paid to that is focused on the struggles of the 1960s and 70s, where we know a lot about the Red Power movement, for example, or the American Indian movement. That was also a really significant time for healthcare activism in a lot of Native communities. And so I'm trying to think about the ways in which those struggles also became bound up with changing notions of sovereignty for Native communities. And this really comes hand in hand with the ways in which we see really quite dramatic demographic shifts amongst the Indigenous communities in this time period, as we see a kind of increasing push towards urbanization. And with that, the kind of proliferation of a lot of diasporic Indigenous communities, pan-Indigenous communities, and the sorts of complications that arise for those communities when they try to pursue their claims to sovereignty when they're not necessarily tied specifically to land claims. And I think looking in particular at the struggles around health issues and healthcare access really helps us to shine a light on what those struggles in particular mean for the kind of changing notions of sovereignty that are really pertinent to these communities.
Absolutely. Well, thank you so much for joining us today, Dr. John, and we look forward to having you back here on Wednesday, February 17th at 6 o'clock p.m.
Thank you.